This week we have an old friend of mine, kind of. Morgan and I used to do research together when I was at Georgia Tech. We actually even have a paper together. And it just so happened that she was in the area. And I said, of course you're gonna do a seminar this week. I'm not letting you get out of it. So I'm really glad that you all get to meet Morgan Hughey, who is an associate professor of public health and a faculty fellow at the Riley Center for Livable Communities at the College of Charleston. She does work on built environment influences on physical activity, healthy eating, inequities in access to nutrition and physical activity, and community-based approaches to improving health and quality of life. She has a PhD in health promotion, education, and behavior from the University of South Carolina. And today she's going to tell us about all of that. So I'll turn it over to you. Let's give her a round of applause.
Thank you. I really appreciate the warm welcome. I'm very glad to be here with you. I traveled across the country, so Charleston's very East Coast. We're on the at the beach in South Carolina, all the way to the West Coast yesterday. So I'm going to a wedding this evening of a friend from graduate school. So it's nice to be here. Thank you, Dr. Watkins, for having me. I know I have a pretty different academic background, but I hope you'll find some shared interest in topics around transportation and active transportation. I will talk a lot about health. I'm also going to just talk a little bit about my path, my career path, and kind of infuse some work I do in community advocacy as well. So this is really a blend of research and career path and advocacy today, which is what I just covered. So I'm gonna keep moving on. It's nice to meet you. So I got to meet a few folks over lunch, but I just wanted to talk here a little bit about how I got to be an associate professor of public health. So movement has always been an important part of my life, starting at a really young age. This is baby Morgan. This is what my mother wanted me to be active in from a very young age. I begged to quit dance very soon after to be I was much more into sports. And so my mom did support this too. She really wanted me to wear bows while I played softball, but I didn't. I'm from a small town in South Carolina, so it's called Gaffney, South Carolina, a very rural area close to the North Carolina border. I was born and raised in the same hometown. I went to college about an hour away in Greenville, South Carolina, so a little bit further south. And I played a sport there. My degree was in exercise science. And that's when I got started with my research path. And I'll tell you about the project that I got started with and how it sparked my passion for this area. I did my master's in public health and my PhD in public health at the University of South Carolina. So we have a big school of public health. And we have a big sports science and exercise science department. So there's a few degrees that really blend the two, both the really science part of exercise, but then the community part and how we make that accessible to folks. During my PhD, I worked for a nonprofit for about 2.5 years. So I helped write a grant that was then funded by the Centers for Disease Control and Prevention, and then I helped execute that grant. And so while I was doing my PhD, I kind of had this practice component that really influenced how I thought about my research and how I thought about what I wanted my academic work to look like and how I wanted it to apply to community. So that nonprofit, really we called ourselves a coalition, was called Livable Greenville. And so we worked on policy, systems, and environment changes for healthy eating and active living. So I ran the active living component where we were working on improving safety of sidewalks, streets, trails, as well as active recreation opportunities for kids. And that's where I got to do fun things like lead bike rides. I got to go on a bike ride in Davis today with Dr. Watkins, which was great. But I loved that hands-on piece too. So I'm a self-proclaimed data nerd, probably like many of you who think about research. but I also really like to be in the community. And so that's a big part of who I am and my work still to this day. So I've been at the College of Charleston since I finished my PhD. So I finished my PhD in May of 2017 and started my faculty job in August. I wanted to talk a little bit about that for a minute because I went to an R1 school where research was very, it was the focus. And I knew pretty early on in that program that I probably wasn't going to seek an R1 type faculty position, which was not a super popular opinion, especially among faculty at the time and with that group of faculty, just because the research was so prominent. It was, postdoc in public health, it was very much to go get a postdoc and then go to an R1 in terms of the academic path. And it just didn't really fit with me. When I was in my master's program, I worked on in a couple of different research labs to get experience, but one thing I was asked to do is to TA a class. It was a graduate level class, and I was pretty terrified of that at the time, and I loved it. I absolutely loved it. So I, despite the nerves, enjoyed teaching. I found joy in that every week, and I kept doing it throughout my master's program. Really surprised. I never saw myself as a teacher. Even though I liked sports, I wasn't really into coaching or anything too much. So a little bit of a surprise, but it worked. And I tried to listen to that and listen to what brought me joy in my work. So I had an opportunity to take a postdoc when I finished my PhD or take this faculty position. College of Charleston is a primarily teaching university. It's a primarily undergraduate university. We have 10,000 undergraduate students and 1,000 graduate students. So I think we're about a fourth of the size of UC Davis when I was Googling about your university. So we're smaller, we're a state institution though in South Carolina, but my teaching is with undergrads. I am on some thesis committees and dissertation committees outside of thesis committees at my university. We do have several very strong master's programs, and I'm on some dissertation committees at other larger universities. So I still get to fill those cups of those fun projects that I see students doing. I'm in a school of health sciences, as Dr. Watkins said, and focus on public health. So my colleagues study everything from, I was telling some students, microplastics in dolphins to air quality. I study physical activity, smoking cessation, lots of different health topics and health behaviors. And my work looks very similar to the faculty that you have, just in different proportions. So I teach, I do research, and I do service. And so I serve our campus on different committees and serve in the community. I just have a bigger emphasis on the teaching. I find that the research I get to do is very community-based, largely in my local community, not exclusively. And again, that's something that really fills my cup in my work. And so I really try to bring my research approach into the classroom. The undergrad experience, I don't know, it was so impactful for me coming from a small town that I just, it has a special place for me. The undergraduate students are figuring out where they want to be, what sparks their interest, and it's a really good fit for me in terms of teaching them. So my take-home message is that's about me, but I encourage you to really explore that for yourself in your path. What sparks your joy? What do you like to do on a day-to-day basis? And to the extent that you can, follow that, even if it's not exactly where everyone else is going or what everyone else is doing. I found a lot of joy in my career so far doing just that. And so that undergrad student centered is still, it's very hands-on. We're a liberal arts and sciences college that really values our college values experiential learning. And so I still have a lot of students doing hands-on data collection. This is with accelerometers in a park setting, students that I have. So what I've also found with my work with undergraduate students is partnering with other universities that have graduate programs, because different students and groups have different skill sets. So some of my students are really great at the data collection component. Being out in the community is such a good experience for them. And then they work collaboratively with the graduate students to learn more about the data analysis and the dissemination that they're not quite versed in yet. Going and doing, was a healthy eating experiential learning. I've led 2 study abroad programs in Lisbon, Portugal, around green spaces. That's another part of my research. And our students are so really successful and present at local and state conferences, accomplish a lot as undergraduate students, which I'll share some in the presentation. So I want to talk a little bit about my overall research area. So this is kind of the health. I'm going to be a health nerd for a second. I hope that that's okay. Public health is my discipline. We are, as a field, coming to grips with the public health workforce, the federal workforce, really having a lot of changes, a lot of the priorities changing. We're trying to stay hopeful, but public health is all about prevention. So rather than treating the disease, which is also very important, very grateful for our medical care system, public health really focuses on monitoring disease and how do we understand how diseases occur and how to prevent them before they're complicated. And so public health touches a lot of different areas. And my work is in mostly what we think about as chronic disease prevention with physical activity and nutrition. So what is physical activity? I know I'm just going back to the basics here, but physical activity versus exercise, I'm pretty intentional about using physical activity. That's any bodily movement that expends energy. Okay, and so that's different to me from a public health perspective, because exercise is often what we think about as like going to the gym, planned behavior that you need, like sometimes a skill set that is more complex to do. Anybody can be physically active. And in fact, walking is our most common form of physical activity by and large in the United States. And so I want this area of that I study, we want people to move more. And so that's what I spend. I also focus on healthy eating, but physical activity is really at the heart of what I love to do. There's so many benefits. So this over here, hopefully you can see a lot of these, but physical activity has a vast number of benefits in the immediate. So as soon as I got off that bike ride, I told Dr. Watkins, I was like, oh, I'm feeling better from the travels, right? A boost of mood, kind of helping with improve my sleep later, which I'm gonna need, by the way. And so there's a lot of immediate impacts, also long-term. So regular physical activity reduces the risk or reduces severe complications for almost every disease in our leading causes of death list in the United States. So heart disease, cancer, COVID-19 are our top 3. And then we have stroke, diabetes, Alzheimer's, kidney disease. Physical activity can have a positive benefit for all of those. But we do not do a good job in the US. It's better in different regions. I'm from the Southeast, where it's the worst, where we have the highest rates of physical inactivity. But overall, youth, so kids 18 and under should get 60 minutes daily of moderate to vigorous. Moderate is your heart rate's pumping, but you can still talk, right? So we talked throughout our bike ride today. We were doing moderate activity, talking back and forth. Vigorous is, you maybe can say a few words, but you're having a harder time breathing, can really feeling that sweat coming through. So kids should be active at least an hour a day. That's throughout the day. It doesn't have to be all at once, but only about a quarter of kids are meeting those recommendations. Adults should be active at least 30 minutes a day, 5 days a week, or 150 minutes per week, and about half get that. So we have a lot of work to do. These numbers are worse in my region where I live. And so one of the reasons, there's a lot of reasons, but we have made it easy for people to sit all day in the US, by and large, right? This is not everyone, but for the average American, there's a lot of sitting from, and I know I'm here and I'm in the biking mecca, right? But in Charleston, this is what a day looks like for a lot of my neighbors, right? People that live on my street, they get in their car to drive to work. They sit in the car line. We were talking about this at lunch. This is the car drop-off line at school for their kids to sit all day and get some breaks. But in South Carolina, our state law is that kids get 1 day of physical education once a week. So they get 50 minutes once a week. So, right, I said they need 60 minutes daily throughout the day. Our policy in South Carolina is not helping them reach that very much. Many of us spend a lot of time on our computers by necessity, and then sometimes we're home in the evenings, we're on our phones, or our kids are on our phones. So we can move, but it often requires more effort, more concerted effort to do that, to get that into our days. What I like to think about is, how do we not make it complicated for folks? How can they integrate their activity in the things that they need and want to do in their day? That's where I think we'll make the biggest difference. I go to the gym once or twice a week, so I'm not negating that. I don't think that's not important. But I think for most Americans, I didn't show this on the data slide, but of those, half of those Americans, adults that meet guidelines, 30% get no activity. So like a third of Americans do not move their bodies hardly at all, okay? So I think if we will be most successful at a population level if we can make it easier to run an errand, go to school, drop off a kid at school, get to work, at least one of those ways being active. Integrating it into those things we need or want to do in our day. And so the design of our community, the infrastructure of our community really has a big role in that. Do we have safe places? I know I feel like I'm really preaching to the choir in this room, but do we have safe places to do that? Makes a big difference. This is the same for healthy eating as well. So 2 parts of my research agenda. One is about access to parks and green space and playgrounds and playground design. And then another is active transportation. So I'm going to talk more about the transportation side today, but I like to give this example too. This was a playground build that I was a part of in a community I lived in at the time, where it was a community engaged. We went in, asked kids, families, what they wanted to see in their playground. We engaged 200 volunteers and we built that playground in a day. So this is a space that had no facilities almost, and we changed it in a neighborhood that really needed it the most. This is a planned project in my city. I'll talk about this a few times, but this is an example of we can create these spaces for people to be active in their day-to-day. I feel like I should have put a map earlier on. I have one in a few slides, but the city of Charleston is a peninsula. And so to get to some of the biggest places where people live and work, you have to cross bridges. And so this is a bridge on this side is where the College of Charleston is, where the Medical University of South Carolina is, our biggest health center in the state, and the biggest employer in our region. On the other side, on what I'm saying, the left-hand or western side, is our biggest residential area in the city of Charleston. And so there's no safe way. There are tiny sidewalks where we've unfortunately had a lot of injuries and a few fatalities. There's no barrier. There's like, I don't even know honestly how wide it is. I think it's like a maybe 5 foot wide sidewalk. People use it, but it's very unsafe. So we have planned, construction has started. This is going to be a standalone bike head bridge that has a swinging mechanism because this is a drawbridge in our city. So this is a big deal in our community. This type of thing doesn't happen very often. Okay, so that's what I think about a lot, and I'm gonna give you a few examples of what that looks like in my work. So this was a study that I first got involved in as an undergraduate student that sparked that joy of active transportation for me. So, right, I played softball, showed you that picture of younger Morgan. Right outside of our softball field, a few years in, I was seeing this construction happening. So it was kind of like a field, a little bit of a wooded area. They were building this called the Swamp Rabbit Trail. Okay, so this is in Greenville, South Carolina. This is a very conservative place. This is a very car-centered place. And in 2009, so I graduated in 2011 from undergrad, the construction of this trail was happening. There was community backlash. Not in my backyard. It's gonna create safety issues. No one's gonna use this. Why are you doing this? But they were doing it, okay? So at the time it was outside of our university up to a smaller town, not the main city center. And it was 9 miles of trail. And so I saw this and I asked one of my professors about it, and he told me that he was doing research on it, and I asked if I could get involved. And so I was doing observations, counting folks, were they walking, were they biking, trying to stop and get people to do surveys. I think about trying to do like an intercept survey here and getting people off their bikes, very challenging, but good experience. And we also did phone surveys at the time to ask folks kind of their perceptions of the trail. At the time, we estimated about 400,000 annual users, so no one was going to use it, but in this pretty small community in South Carolina, about 500,000 people were. And today, what started as 9 miles, it's now expanded 28 miles. There's a Swamp Rabbit Cafe and Grocery. The hockey team is the Swamp Rabbits. There's a Swamp Rabbit Brewery. It's become a community icon. There's plans for expansion throughout the county up to to North Carolina, the neighboring state. And this is a standalone trail, not with cars. It's a beautiful way to immerse in nature. So when I lived in Greenville, we would ride. I rode the trail every week. I rode it to play flag football on Thursday nights. It's a staple of the community. So here's my map of Charleston. So I moved away from Greenville. Again, I took my faculty position. I was looking for a low-hanging fruit project when I first started my faculty position to get my, kind of get my feet wet of being in the city, learning who the partners were, trying to manage my research group, get students involved. And so I did a very similar study. So that's also a lesson learned. Sometimes when you're starting new, start with what you know. So methods-wise, direct observations, intercept surveys along 2 trails in Charleston, South Carolina. So when I got there and I started asking questions about active transportation, how many people were biking, how many people were walking for transit, there was very little data. There was some state level data, and so I wanted to know more. So I tried to do that. So I live in Charleston. Our city population is about 150,000. Our metro area is about 850,000. So not that big, I know, compared to a lot of California cities. We're the largest city by population in the state of South Carolina. We have a population growth is really strong in our city and has been for the past decade or so. And right now our median household income is $90,000. So we're fairly, I don't know if wealthy is the right city, but we also have issues with poverty and big gaps in the wealth in our city. So just a little bit about our city. So I wanted to study 2 greenways. And so we have a greenway here. So where that bike pedestrian bridge will connect, there's a 9-mile greenway that runs alongside one of our main highways, Highway 17. So separated from the highway, the bike ped bridge will connect it to downtown. This is also part of the East Coast Greenway, which is an initiative to have a greenway from Maine to Florida that's safe for people to bike. And so being along the coast, we're a main part of that. So we work with that alliance as well. And Charleston is one of the most unsafe places in our state for that greenway. So this will be a huge connection for us, but I did observations on the Greenway, and then we do have a bike pedestrian bridge on the opposite side towards Mount Pleasant. And I did the same observations really to compare, just really seeing who's using it, what are they doing, and with the surveys, getting their perceptions of those spaces. So more people biked on the Greenway, which is much flatter. There's no incline. It's 9 miles consecutive. So we saw a lot more biking on that path compared to the Ravenel Bridge. So the Ravenel Bridge is 2.5 miles, but we have it's the biggest incline in our city, actually. We're very flat, but it's the only place to really, if you want to run or bike up, it's the only place. So I think as a result, we saw a lot of biking, more biking on the Greenway. Women were we saw less women overall, and women were much less likely to bike in either one of these spaces. We also asked folks about their perceptions, and so females rated like what was important to them for using these spaces. Safety and security, females ranked significantly more higher than our males. It was their top concern. And natural scenery. So the aesthetics, trying to be in nature, spend time in nature. We also saw or taught the folks that we talked to who we would consider racial ethnic minorities. Our biggest groups are white and black in South Carolina. Getting to and from places was ranked more highly for our minority population than our white population. So we saw some interesting patterns. One thing I want to highlight is we did that study again in 2021, and we added a space that's going to be a linear corridor called the Low Country Low Line. I've shared all of this data with our planning groups, our transportation engineers, with the city whenever they've asked. So I think I've shared it with over 10 different people or 10 different groups in thinking about design of what we're calling the Ashley River Crossing or other projects. And the data that we've been a part of, this is two of my undergraduate researchers doing their observations and surveys. This is the low line. So here's our peninsula. I'm gonna come back to my main point here, but here's our peninsula. This is where the bike ped bridge is gonna be. This is where the Ravenel Bridge is. So the idea is that we have a connection, at least one safe way to get across and through the peninsula to both sides of our community. And then we're gonna have a north-south route, hopefully with what we're calling the Low Country Low Line. So it's gonna be alongside an interstate that was built coming into the city. So kind of building into that advocacy piece, I want to advance the research, the literature within my area, but it's really important to me that I ask the question, can this be useful for my city? Can this be useful for students? Can this be useful for my city? And I try to answer those before I go into a project, but these have. When we redid that study in 2021, we used that data for a big federal RAISE grant that was for $10 million for the planning phase of the Low Country Low Line, which the city received. So it's one component. The grant is a big lift, but we're able to use that data, to help the place that we live in. Again, I said data just on how many people were using the Greenway at the time and who was using the bike ped bridge that was already built, helped at least contributed to some of the decision making with the city in some of their planning of the bike ped bridge. So these are some important ways that not just from publications, which I have those at the bottom, right? We're academics, I want to publish, I want to expand that knowledge, but these are pretty equally as important to me. Another way that I've studied active transportation is through bike share. So there's 3 studies that I want to talk about. This is how I met Dr. Watkins. And so I've worked with faculty at the Citadel. That's our military college of South Carolina, about 3 miles away from my college. And they have a big civil and environmental engineering program. And so it was funding through the state multimodal mobility with different South Carolina institutions, and then STRIDE, which was a regional, how would you describe, regional transportation
UTC.
UTC,
So like
thank
our PSR that we're part of, this is the Southeastern University Transportation Center.
So I focused on the health element, right? So still, I know you're seeing more of that. But I hope that as I'm talking about this is maybe even in this short little talk, you'll think about that how people get around influences their health directly. And so maybe in your work, you'll take that snippet with you wherever you go in making decisions. So the first study we did, the bike share was really, Charleston was the first city in South Carolina to have a bike share that had more than 10 bikes. So there was one city that had a really small, like 10 bike size. And so our bike share had, when it was launched, 250 bikes around about 40 stations, which is pretty sizable for South Carolina. And so we, with the bikes collecting the second by second GPS data, we really wanted to see where people were riding. So my transportation colleagues did mapping of the different rides, the different street segments, and compared that to a level of service, level of bike service. I wanted to try to estimate how active people were while they were doing that. So we complemented our work. So I want to show you a little bit of their map. I don't want to try to talk, too much about their work. I'm going to talk to you about what we did. So we couldn't put, a lot of times in a lab setting for physical activity or exercise, we would get people on a bike and measure how much they're moving, measure their oxygen consumption in a very controlled experiment environment. Well, we can't do that with a bike share, but we had their GPS data. And so what we tried to do is use the average speed, and we compared that to what is called the compendium of physical activity. So this is an epidemiological tool that estimates, on average, when people do different activities, how much energy they're expending. So we were able to take that, and that's called metabolic equivalence. We call them METs in my field. And a 7 mile per hour bike ride is about 3.5 METs. That corresponds to a moderate level intensity physical activity. And so using this formula, calculated the average number of METs per bike ride, using speed that we calculated from the GPS and the compendium of physical activities. So kind of population level study. In 2018, we had about 35,000 bike rides for our bike share. I think even just this number for our city officials was pretty impressive. Wasn't really sure how this was going to go in Charleston. And so that, descriptive information in and of itself was good for us. On average, folks went 2.4 miles on the bike share. Our peninsula spans about 3.5 miles north to south. So to me, that was interesting as well. And an average of 42 minutes spent on the bike share bikes. The average speed was about 5. So some descriptives from our bike share back in 2018. One thing we did have with the bike share company at the time was people to use the bike share had to sign up as a certain type of membership. And so they're based on how those were categorized, we were able to estimate whether folks were visitors. So with day passes, and they were really we have a big tourist population that comes to Charleston. We were really able to indicate about 3 different membership types that tourists used. The other membership types were students, employees of different organizations, including the medical university. The medical university was a sponsor for our bike share program. So we were able to compare local and non-local, at least to the best of our ability. And we think we were pretty spot on. They were about evenly split. A slightly more tourists using the bike share, but we still had about half of local folks using it as well. Big differences as we expected between these groups. So tourists or visitors to our city went further and used them longer. So the average duration for our local memberships was about 16 minutes. So really getting to us indicating getting from one place to another versus exploring our city for over an hour. With that, we saw really different physical activity levels. We saw that local folks, again, in getting from point A to point B, had higher intensity of physical activity. So more in our moderate and more in our vigorous categories than kind of our light to moderate for visitors in the city. This is really important in Charleston for us because we kind of often have this battle as a city that sees a lot of tourists and what's for people that live here and what's for people that are visiting. And a lot of there's a not just in infrastructure but in business, there's kind of a push and pull with that with our local officials all the time. And so we presented this data to our traffic and transportation group and our city health and wellness advisory committee, really showing that people are using this, but they're using them in different ways. And really to encourage them to think about that as they're considering expanding the bike share. The next study was when I met Dr. Watkins, and we wanted a student in particular, Jenny was such a lead, this is Jenny, doing data collection, and she was really instrumental, so undergraduate student in this paper. And so we wanted to understand energy expenditure differences between regular bikes and e-bikes with our bike share system. E-bikes were coming to the city, and this was actually before they got there. We wanted to see what were the differences. So we looked at energy expenditure, trip characteristics, and we did a short survey with folks. So very different than the studying the bike share for the whole year of 2018, where we looked at 35,000 trips. We had 15 people participate in this study, but we needed to see them multiple times. So folks we recruited healthy individuals from 18 to 40. They came into our exercise science lab and we did a bicycle fitness test of them so that we could kind of adjust for people in our analyses, adjust for people having different levels of fitness when we were doing our analyses. And we also measured their body composition. So that was one visit for the study. Then we had two more. So our participants did two 60-minute bike rides in one of the few places we have a bike lane. So it was a little bit repetitive. It was in a loop around a park, but we really needed it to be safe to have folks participate. Whether they rode the regular bike or e-bike was randomly selected. Whether they rode which one first was randomly selected. So some people started with the e-bike, some people started with the regular. These were the bikes that were part of our bike share system. So we had the regular bike that was part of the fleet, and we had the e-bike that was going to be launched in the city in the following year. So they brought us one to use for our city or for our study. We just instructed folks to ride at a comfortable pace for them. So we call it a steady state bike ride for 60 minutes. They wore a heart rate monitor. We did stop them every 15 minutes to do a survey to see their level of exertion. So we had to see them a lot. We saw each participant probably about 4 to 5 hours total, including all the recruitment and everything. So we saw significant differences. This was the paper Dr. Watkins was referencing that got published in Journal of Transport and Health. And so we saw that so the fitness identifier we were looking at is percentage of heart rate maximum. So that accounts for people having different ages. Different ages have different heart rate max. And so to no surprise, e-bikes were a lower percentage of people's heart rate max, but this was still very much in the moderate category. So we had the pedal assist electric bikes, pedal assist, and this fell well within the 50 to 75% range, which is moderate for moderate level physical activity. We saw, again, to no surprise, significant difference in how far folks went, almost 6 more kilometers on the e-bike, and at an average speed of about 21 kilometers per hour compared to about 14 and a half on the regular bike. So maybe not surprising, but we were able to quantify the differences between these folks. Folks also reported higher perceived exertion when we were stopping them, those every 15 minutes, lower difficulty, lower tiredness on the e-bike, and greater enjoyment. So we asked folks kind of some perception questions, and folks enjoyed them more. But no differences in safety and comfort. Again, we were in a pretty, they weren't riding with cars environment, so we think that also influenced that result. This is Jenny. Jenny led this as an undergraduate student, so I mentored her, but she did every aspect of data collection and analysis. And so just kind of tying in when I talk about my path and I talk about undergraduate students, they're so talented as well when given the opportunity to shine. Jenny's now a nurse, so you know, she doesn't have to follow, you know, exactly in my footpath. In fact, I want her to follow her own path. But it impacted her to be a cardiovascular nurse. She went to George Washington and really just wanted to focus in that area. But she talked about the importance of the hands-on experience. She loved working with the people. She loved doing the data collection. It influenced her. She was not thinking about nursing school before doing this research study, and she saw how much she enjoyed working with folks. That's a big win for me, bigger than the publication that we got. And then another student recently looked at differences in our physical activity between our bike share system before we had the e-bikes and then after we had the e-bikes. I pulled this data. I hadn't looked at this in a while, so I only really had this one slide from her study. But what we did is we took data from 2019. This was also pre-COVID. So our bike share research had a lot of challenges during COVID-19. So we had some good wins to have the amount of challenges that we had. Another year in 2021, so we took all the trips from July and October of each of these years. So we had comparable years. And in 2022, the e-bike was launched in the summer. When it was first launched in those first 6 months, they had not expanded the number of bikes or number of stations. So we kind of had a pretty even comparison of usage. Long story short, we saw about 8,000 rides in those months in 2019, a little bit lower in 2021, coming out of COVID-19. We saw a huge uptick in our e-bike rides in 2022. To 19,000 for those 2 months combined. We saw a shorter duration of trips and shorter distance by a bit. And what this student was really working on is trying to do that physical activity estimation. She used the data from Jenny's study that showed the percentage difference, which is about 13% difference in the physical activity, to kind of do a correction factor for the MET estimation. So we haven't tried to publish this yet, but we've shared this with folks in our traffic and transportation for our city. One more study, and then I'm gonna wrap it up with some advocacy. Am I good on time? Good. Okay. So this is where my two worlds blend a little bit, thinking about access to parks and green space and access to active transportation and our infrastructure. For the past several years, I've worked with a national nonprofit called the Trust for Public Land on a project about policies to increase access to parks and green space across the US. And so we've done a policy scan. We created a tool together to look at the different types of policies local governments were using to increase access to parks. This sounds so, I know this is like, what is she talking about? Why is she telling us this maybe? One of the reasons is connectivity came up. And it was actually the most common policy. We did a policy scan of 25 cities. We selected from different regions, different size cities to see what folks were doing. Connectivity was the most prevalent. So with the movement around complete streets policies, we see that cities had adopted connectivity policies, many of which directly addressed or at least had language about access to parks. So transportation is about how people get to all kinds of places. And so it's not just about having a park. People can have a park, but I argue this all the time, but if they can't get there safely, if their kid can't get there safely, they're not going to use it and they're not going to see the benefit. So I pull this element of active transportation into this side of my work all the time to remind people that if you have a intersection that you won't cross, how can we expect kids to get there on their own? And so we saw a lot of connectivity policies, we documented them, and we actually see that as a way that some of these other policies around land use and development, public finance, that parks and recreation can move towards having more of those policies codified, similar to some of the complete streets and connectivity that we saw. So that's a little bit about my work. I've talked about my community impacts throughout, but I also wanted to share that I'm on this. So with the initial bike share work, I presented to these groups, the data that I was collecting, the results that I was finding to try to push for better infrastructure in my own city. I'm now a part of both of those groups. I was appointed to this Mayor's Wellness Council. And so I sit with a group of folks, we meet monthly, and we have different initiatives and different communication methods with our city on how to promote health. And so I really sit on that committee to promote activity and physical activity. And because I care so much about active transportation, I get to talk to people about that all the time, or remind them that it's a thing, that we don't just have to use cars. Even that is sometimes really hard, where I'm from. But I'm glad to have that voice on that committee. And I'm on the board of our local advocacy coalition. It's called Charleston Moves. I want to talk a little bit about Charleston Moves just for a few slides. This is our vision. We envision a connected, safe, accessible, and equitable Charleston County. So we work not just in the city, but in the surrounding region, where each of us has a choice in how we move from one place to another, because the streets belong to everyone, pedestrians and school kids, people on bicycles and people on buses, citizens in wheelchairs and with canes, all of us moving safely together. So this is our vision for our area. Our organization is celebrating its 20th year this year, which is exciting. Sometimes it's exciting, sometimes it's depressing, because we look at our network of bike infrastructure and we wish it was so much greater, but there's been some good wins. I presented this to our city wellness group a couple of weeks ago, actually. We have a big race, a road race called the Ravenel, it's called the Bridge Run. It's the third largest 10K in the country. So 40,000 people run it, and they shut down the bridge and people run from Mount Pleasant into the city, and then it's a big party. It's a lot of fun. But the bridge, the original design of the bridge, they were needing to rebuild the bridge for safety reasons 20 years ago. They built it in 2005, and the original design did not have any bike ped infrastructure. It's one of the most used amenities in our community right now. And so we look back at I presented this to the group. 20 years ago, it wasn't Charleston Moves, but it was the Charleston Bicycle Advocacy Group. And they did this campaign where they sent postcards and had t-shirts, and they just flooded City Hall with we can't wait to bike the new bridge. So it wasn't part of the design at all, but mayors in both of the cities got bombarded, and it became part of the design. So they officially launched the nonprofit then, which has moved from focusing only on bicycles to really we focus on bicycles, pedestrians, and folks using public transit. And so next month, so we've been working really hard on this. I love our graphics. I hope you do too. We celebrate Mobility Month. I think it's traditionally a lot of biking focused events, but we've really tried to expand it to Mobility Month. And so we'll have 2 bike rides that hopefully will have hundreds of folks. They're kind of the police We have to have a police escorted ride in the city of Charleston because there's not enough spaces to have a bike ride. It's also 200 people riding at the same time, but we'll have our 20th anniversary ride and our ride of silence to honor those that have been injured or killed. Bike to work day with local businesses that really support that and give us a % of their proceeds. We have a historical lecture. This year it's on what's under the streets of Charleston. And we have a light the night. So our North Charleston is immediately north of our city. It's one of our most impoverished areas. It's also the area that has the biggest percentage of people using their bikes for transit, with not a lot of infrastructure. The laws are really wonky in South Carolina about technically folks on bicycles can't use the sidewalks. So we have to be really careful in our language around safety and what we promote, but what we can promote is lights. Everyone is supposed to have a light. So we do more education, but we call this Light the Night, where we do a free bike community resource fair and bike light giveaway in North Charleston. And so in the South, what this looks like is partnering with one of our biggest Baptist churches. This is a historically Black church, which is very present in the community from an advocacy standpoint as well as a religious standpoint. So partnerships are so important in this work that we do in the city of Charleston. This is our bridge run. It's a picture of our bridge run with the 40,000 folks coming over. They're actually not using, like they shut down the whole one side of the bridge. So this is our bike ped infrastructure on that, but it's not even used. But just as I like to really use this as a reminder. It's such a fun day. It's such a big community building event. There's a lot of nonprofits that benefit from this. That we should have more spaces that look like this more often, where people can use the streets and use the spaces in our communities. And my argument where I come from at it a lot is it will make us healthier. If we give folks safe places to be active, it will bring them joy, it will help them be more active, connect with their neighbors. And that resonates with everyone. So that is what I do. I thank you for your time. I know it's a different perspective. Hopefully you could take a little bit away. And thank you.
Questions from Morgan?
Yes.
Just on that last, the Light the Night and all those others, you said they needed a police escort. Are there any movements that are less sanctioned happening with bicycling and advocacy and all that?
There's a group called Biking by Charleston that's really trying to get like Thursday night bike rides that aren't, they're not police escorted. And so I've done that a few times and they're really fun. The city pushes back sometimes, unfortunately, just because our region is one of the most unsafe. I think we're ranked 9th in terms of injuries and fatalities for bicyclists and pedestrians. So anytime there's even an informal movement, our city gets wind of it and tells us we need to get a permit, but it's complicated. It's tough. One of my roles, this is not your question, but one of my roles on the board is to raise money for our organization to support and sustain the organization. We have paid staff, not many, but we have paid staff. And so I recently got a sponsorship for Mobility Month from a local business, nursery business that sells plants, but they believe in biking and walking. They want to do a discount for people to bike and walk to their business. They can't in good conscience do that. There's not a connected sidewalk network for most people to get there. They would need to cross a really unsafe intersection that kind of loses its sidewalk for a second. There's no bike lanes. So we come up with a creative solution, but when there's not infrastructure, it's challenging sometimes to promote people doing it because you're worried for their safety. Unfortunately. Yes.
Yeah, you mentioned that. So first of all, thank you for this very enthusiastic and down to earth presentation.
Yeah.
Yeah, it's really easy for us to understand. And just wanted to ask about you mentioned that in the lower income areas of Charleston, there is like very low infrastructure, so people kind of rely on like bikes and transit. I find that kind of like, very contradictory, because like usually you actually need some kind of bike and transit infrastructure for people to like effectively use it. So, and also you mentioned that people are not allowed to bike on the sidewalk. So I guess that doesn't mean that people are kind of like forced to bike on like the side of the road, and which is like very unsafe for them. Like, and if so, like, do you think there's like a better strategy to like improve like the bike infrastructure, like so that it's better connected to like the greenways, for example, you mentioned earlier in the
Yeah.
Yeah.
Yeah, I have a couple of answers to that. I mean, we have these plans, we have these networks and routes, especially on some of the main roads. People do ride on the sidewalks. Here's the thing, I do too. So I ride my bike or bus to work every day. I was telling Dr. Watkins, I was like, I get on my bike though and hold my breath, right? So I share my location with my partner because to make sure I'm not like lying somewhere hurt on a bicycle. I don't, there's no bike lane on my route. It's not very far. It's like 3 miles, but I ride with cars. Or if it gets really busy, I'll jump on the sidewalk. And I'm not technically supposed to do that. I've never gotten in trouble for doing that. But us as an organization, we can't like promote that. We can't say, well, ride on the sidewalk to save your life. It happens anyways. But in North Charleston, where it's the most impoverished area, it's bikes by necessity, not bikes by, we're not talking about recreational bicycling. It's for people to get to work. Our public transit is also pretty poor in Charleston. We have a bus system. It's okay if you don't have to switch routes, but if you have to switch routes, it's really challenging. So I'm trying to get to your answer. There's a lot that we need to do in the areas that need it the most. Don't want to take away space for cars. That's the biggest argument that we hear a lot. So I hope that kind of answered your. It's a little. It's a sad state in ways. Yeah.
Oh, well, I don't know if they would consider a law like this, but I know that there are some places where if there's a bike lane, you have to ride in the bike lane. But if there is no safe bike lane, then you're allowed to hop on the sidewalk.
Yeah. Yeah, that would be a great question.
So it
Maybe.
doesn't legalize it everywhere, but
Yeah.
just where there's no other choice, and then it kind of incentivizes cities, like if you don't like them on the sidewalks, give them someplace
Yeah.
else. Oh, and the other thing, the question that I had though was, is the research that you and I guess Jenny, your student, were working on, is that available online anywhere?
It is. That's and I can share this
Okay, yes,
presentation
please.
too. I have the citation that is in the Journal of Transport and Health.
Oh, okay.
Yeah. So that one's published there. I think it was I think that was 2022 paper. 2022, 2023. Before baby. I also have a 9-month-old that I traveled with across the country yesterday. So I'm really glad I just made it through that talk with the sleep that I've had. But yes, we that was pre-baby times in my mind. Yeah.
Yeah,
Roy.
yes,
Yes.
thank you. Coming from a place where we do not have anything closely related to ballot measures, I've been recently very curious about them. And just listening to everything that you do from academia to advocacy to working as closely as possible with the mayor's office, I wonder what's the threshold between what you're doing now and a time when there can be a regional or at least statewide move towards ballot measures to improve this infrastructure for your area?
It's a good question. I think we're closer. You mean ballot measures to like a vote by the,
Yeah.
yeah. Okay, just making sure. So our county this is interesting. Two-part answer. Our city just passed a ballot measure for green space, but some of it includes, it's a little bit more pedestrian infrastructure oriented. But in that, it was a vote for a bond. It was like a $70 million bond for increasing access to parks and green space. It included surrounding areas for walking. So I called that a win. Our city supported that. Our county had a ballot measure in the fall that did not pass by a lot for transportation. A sliver of that was going to our greenways projects and to bike ped more than ever. I still wish we would have had more, but there was still a good chunk there. The county it didn't pass. It had nothing to do with bike ped because they have not followed through on so many of their other projects generally that I mean, it was like 75% of people said, no, we're not.
Yeah.
Not giving you the tax, you know, it was like a 1 cent tax, or I think that's what that one was, and.
Yeah.
They said, you've done one project on the list of 10 that you gave us last time. So our mayor, though, I was telling you about our mayor, he is trying to take the initiative on a new ballot measure, kind of from the city.
Yeah.
Instead of the county. So it's just it's political. So I think we could be closer. We're getting the first bus rapid transit project in South Carolina from our outskirt area called Somerville and coming through North Charleston to the city center. And so that's funded. I think construction starts in 2026. It's a mix of where that's been funded through. The city is one piece of that. I think how that's done and executed is going to be really important for any transportation ballot initiatives. If they can't like get it done, I think it's just folks want to see if folks are willing to say, especially in the South, we'll give you some more of our money, but they don't finish projects. It's just really hard for folks to vote for it again.
Thank you for your answer. I'll be curious to keep talking to you about it because
Yeah.
Nairobi, which is the capital city of Kenya, we only have about maybe 2 or 3 advocacy groups who only ride bikes as a recreation, and they're having such a rough time talking to authorities about making the infrastructure better.
Yeah.
So I'll be keen on talking to you later about what that's look like.
Yeah,
Yeah.
please, I would love to hear about that. Yeah, and it's like, you just gotta keep them, I think with the politics, it being, and it's mostly local, it's mostly local politics. Like the bicycle and pedestrian bridge got funded during the first Trump administration because 2 of our our state lawmakers that go to Washington really advocated for it. That was a big part of it. We met it with local money and some state money, but it was a big federally funded project, and it came under an administration we weren't necessarily expecting, but it was from that local advocacy. And so the local level can have such an impact as well, and I try to keep that in mind. Yeah.
I'm curious about your thoughts on how we can promote year-round physical activity.
Mhm.
Thinking about is it Charleston or Davis when it gets really hot, or I'm from the Northeast when it's cold and wintry, what can the cities do to kind of keep people getting outside or kind of to support through times where the weather's not on our side?
Oh, it's such a big deal because it's so warm. It's like
Yeah.
oppressively warm, and
Yeah.
it's not very humid here.
No.
Very humid in
But
Charleston.
it gets so hot that it's still hot, even
It's
though we
like-
don't have the humidity, like 110 degrees.
Yeah. It's a good question. I don't really have a great answer. I think about this a lot on my green space work. We've studied shade and the differences in temperature, especially with that area of my research. I focus a lot on children and playgrounds and playscapes that have either natural shade or shade structures. They're just so much cooler to the touch, and then they're more used in the summer. I don't know how that translates to active transportation per se. I think places having supports, not only having places to park your bicycle, but having facilities to account for that. I'm a sweaty mess when I get to work a lot of the time of the year. But because I work in a school of health sciences, we have the gym and I have a locker, but other folks on campus don't have that. So I have a little bit more of an advantage or support to use, and I do use it, or else I would look like a mess going to teach my classes. So I think that's part of the answer, but I don't think that's fully getting at it. Do you have any ideas?
Thinking about coming from the Northeast, I think I've noticed how much being able to be active basically year round in Davis has made a huge difference in the first 6 months I've been here.
Yeah.
So I guess I don't know that I have an answer either, but I'm just thinking about how, I don't know, are there ways that, my hometown could get through the winter differently than we do? But
I have a colleague in Denmark that I'm close with, and he often says, he lived in Copenhagen for a long time. He's not there any longer. And he's like, it's not, there's no bad weather. I don't know if I fully believe this statement, but there's only bad like year. But they do really practice what they preach, and I mean, they bike all the time. He's like, my kid bikes in all the elements, and so, yeah, I mean, I try to think about that. I don't think that quite translates to America the same way, but it's an important question. We try to argue that in Charleston. We're like, it's so, I mean, until it's oppressively hot, it's so pleasant. Like winter, I mean, we should, I mean, 2.4% of people bike for transportation in Charleston. We have no hills, and like the average temperature is 70 until it's hot in the summer.
Right.
So it just, but people are fearful. I mean, they're genuinely fearful. My students are our campus is like in the heart of downtown. It's not, it's not a college town. It's more of a city with a college in it, if that makes sense. And so, yeah, they just kind of get what happens in the city, and they walk because we do have a pretty robust pedestrian infrastructure for them to get places and get around campus, but they will not bike. They will not. Most of them, it's the really brave ones. So anyways, I diverge, but yes.
Oh, I was just going back to the shade structures.
Yeah.
I don't think that we would ever pay for this now, but this is something I've literally thought about before and thought about a lot. And one of the things I was thinking for places like Davis, which is hot, where it's not necessarily snowing, is if like we could have vine covered arches like this. I don't know if that makes sense. Like if you have a trellis up here, you have like a bunch of vines that you're training up so that the sides are open, but the top is covered. And then you put like strings of light underneath. You're lighting it so that the light isn't going up into the sky. And I've also thought about like if you could get some kind of cloth that was also like water or snow proof. And you could like roll it over, but I think the price would be so high to do something like that, the US would not go for it. But I think Americans don't like being exposed to the elements. And if you could protect them from rain, snow, and sun, but let them be outdoors, they would like them a lot better. I just don't know how to like pay for that.
Yeah.
Even if it's like something that's kind of not as expensive as like a road or a bridge, and you're just talking about like outdoor coverings. I don't know.
Cool idea.
Have any of you guys?
I was also on a thesis committee for a master's student who was looking at canopy coverage in our city related to biking and walking and places where people would bike and walk. And she was looking at differences by like race, ethnicity, and income, which we saw places that were lower income had less canopy coverage. But it really begged the question too of like, what can we do that better? It's complicated in Charleston because we have a big hurricane season. And so the type of trees and the planting, and it's all pretty strategic with the city. That's not my area of expertise, but I've thought about that a lot, but also just the risk of hurricanes is very real, and that investment versus the risk is a hard question.
Yeah.
Just throwing in another element.
Yeah, no,
into it.
thanks.
Yeah, that's one of the reasons why I was thinking about vines. Sorry,
Yeah.
is they don't have branches to, mess up your wheels.
Yeah, was someone else saying?
We have a question online.
Oh,
so
sure.
I will ask this, so we do broadcast
Oh, okay.
this,
Yeah.
and it will be up online if you ever want to
Oh,
refer back to the
great.
talk in some way to other folks. Marianne asked, how closely did you work with the South Carolina Department of Transportation when studying the greenways? So do you do any of your work with the state as opposed to?
Those projects I haven't worked with South Carolina DOT at all. Yeah, I haven't done much with them, to be honest. There's been some good changes with our DOT. South Carolina has one of the highest percentage of roadways that are owned by our state. It's a big challenge in the city of Charleston. Some of our main streets that have been contenders for bicycle and pedestrian infrastructure are owned by the state. And it's a challenge. What we say we want as a city often isn't represented in what's presented for the project. we had a project where they were offering essentially a buffered bike lane, which we were shocked. We had just, never really seen that come out of the DOT, at least recent, and when I have been there. And then we had a big challenge with, I was telling you guys about this, the historic businesses that said we didn't want a protected bike lane in that area. So to answer the question, I haven't worked with DOT a lot. Our advocacy organization director has been really pleased at the direction and more of a commitment from the DOT in recent years to focus on that. It's because our safety numbers are so bad. They really want to see that change. And so they've been doing road safety audits in our most dangerous corridors and coming up with at least plans for the local jurisdictions. They then have to vote or agree on what that looks like. But they've taken attention to those recently. So I haven't collaborated with them a lot, but we're hoping the direction goes better.
I might have missed this, but does the implementation of e-bikes lower the physical activity of the rider compared to the traditional conventional bikes?
It does.
It does, right?
It does. It's a really interesting public health message, right? Because for the individual rider, the activity is lower. It's still in what we would call moderate intensity. Our study showed moderate intensity. And it's kind of combining results, moderate intensity plus people being more willing to ride e-bikes as a whole. Some of our data suggests that we could have a good population impact with e-bikes, the pedal assist ones where folks are pedaling. But at the individual level, it's less intense of a physical activity. Still movement, but less intense. But a lot of people don't want to sweat going to work or to get from one place to another. So I don't know, this is more of a personal opinion. I'm a proponent of both. We asked folks, we didn't do a statistical analysis, and we just had 15 participants, but we asked people whether they would want to ride the regular bike or e-bike. All but one person said they'd rather ride the e-bike for transportation, for trips, for running errands. But it was half and half for recreation. So we also asked them if they'd rather use the regular or the e-bike just for pleasure or leisure. And half said the regular bike and half said the e-bike. So I'm kind of a proponent of having options for folks. I think the public health always thinks about the population. So how can we get more people moving? If pedal assist e-bikes would help with that, I'm on board. But yeah, that was an expansion of the answer.
One thing to keep in mind though is a lot of these bike share bikes, I don't know how many non-electric bike share bikes you guys have ridden, but these are pretty substantial, heavy bikes. So this is not a choice between a bike that we would typically ride around Davis and an e-bike. This is a choice between this bulky.
They were heavy. The ones we had in our study were very heavy.
Yeah.
We accounted for the weight in our analysis and stuff, but yeah, it was. Yeah.
Follow up, do you know how much more expensive it is to get the e-bike version of the bike share compared to the conventional one?
I don't know the answer to that. You know?
For people, or you're saying if the city was bringing.
No, for the customers, for the users. When they choose to use the e-bike or the conventional one,
Yeah, did they ever run them both at the same time in Charleston? Yeah, most cities do replacement, and I think that's a lot of what we're seeing is that over time, because these are such heavy, substantial bikes, so that they last a really long time and nobody steals them and all the reasons, we're just seeing this switched e-bikes. So there is one of the companies in the Bay Area, I think, has both e-bikes, and so they've probably done research comparing the usage and things like that, or if not, that's ripe for the picking for one of us to go do research with them. But Bay Wheels, I think, has both e and regular bikes.
Yeah, I know City Bike with in New York, they
Yeah,
do
City
have
Bike.
Okay, do that.
Just wondering.
Yeah.
It's really interesting in Charleston too, because we saw a lot more riders with the e-bikes. When we had the same number of corrals and same number of bikes, but it was a whole new company. I mean, our bike share company changed over a few times during COVID, but it changed to Lime bikes with the e-bikes, and they only do like the per minute or per ride option for the most part. The previous company had like a subscription service, and I think that's why we saw less trips. But if you were a member, students could pay like $50 for a whole semester and ride it as much as they wanted. And so a lot of students I've heard talk about how expensive it is for the Lime bikes. They really like them, but it's more per trip, but we saw more trips. So I don't know, but different payment models we saw for sure.
Is there any talk on, and I don't know how mechanically they actually work, but with the attachment, electric batteries onto conventional bikes, and especially you said the bike mode share is likely greater in North Charleston.
Yeah,
Than going in and providing those to that community specifically.
I haven't heard any talk of that. Our city doesn't allow scooters.
No, more on like there's these attachments, I don't exactly know how they work.
So
but
a
it's
personally owned bike.
Oh,
Right,
you know, like,
exactly.
yeah. I was just wondering, I don't know if our city could do something, but when a city tried to drop the scooters, they dropped them in our city like corralled them up and said, you need to take them back. So they're just really particular, and I don't know if they would even be particular for that. I don't know if they can, if it's personally owned bikes. I don't know. I know they have more control over like the bike share. I don't know, I haven't heard, so your thinking is just that, so tell me why, so you're thinking that would just like, how would that help?
Well, I guess it would more help on a universal level, but just making it easier to use. It disregards the safety aspect, but as you've discussed, people are more likely to take trips with an e-bike, and then there's these attachments that can attach to people who are already traveling by conventional bicycle.
Yeah.
To make that easier for them and expand their opportunity.
Yeah.
Availability.
To get, like, increase their radius, cause
Right,
they
exactly.
exert themselves less.
Right.
Yeah.
What do you think, Carrie?
I mean, I could see them doing it in some communities,
Right, yeah.
yeah.
I feel like just dropping it in like at a universal level to a city, like saying, we'll give you for free if you wanna upgrade your bike, that could be beneficial, but it doesn't help with the safety, which is
Yeah.
the biggest portion anyway.
A lot of the bike share companies like Lime and Spin and such run discounted programs in various cities so that they can subsidize the bike share bikes for people to be able to use. So you can like qualify for, you know, this discounted pass to use the services. That's probably the closest that I've seen to that.
Yeah, I know that Lime does that. We've found it pretty hard for folks to apply for, at least in our city. The company that was before Lime but went out of business had that and had it in a way that we could really like go into target certain communities and help them use it a little bit better. But yeah, they want to expand. They want to take the bikes off the peninsula. They want to have them on the greenway, and you know they're constantly trying to negotiate for more stations and more bikes in the city. But again, it does. You know, it's always a big safety question mark, especially crossing the bridges that I've talked about, because that's required except to get to North Charleston. So it's a complicated discussion. Charleston is very particular about aesthetics, so we're a really historic city, and I've heard from on the Lime side of things, honestly, that we're hard to work with because we wanted a certain look to the bikes and really are particular about where the stations go and having the geofence stations and things like that. So yeah, it's a push and pull of like the control of those programs.
So I see that we're bumping up. We're only 1 minute before 3 o'clock. So I said, I think we should thank Morgan one more time.
Happening.
I will see you guys next week. Please stick around if you're interested. Today it's the monthly time when we're doing the professional development series. So you might have seen this advertised. Today the person who's coming is Brandon Minto from our our UC Davis sort of like federal relations area. And he's gonna talk about sort of newer developments and language and all kinds of very useful things if you're involved in federal funding and all. So please stick around for that.
Thank you. Thanks for having me.